Hello, for our English-speaking audience, please use the translation option in the toolbar at the bottom of your screen. Bienvenue à tous, je suis
Hello everyone, I'm Philippe Vincent, Program Coordinator from Quebec for the Kidney Foundation. We're at the second day of our patient forum, Living Well with Kidney Disease. Yesterday was excellent and we're very happy to share more information and resources with you today. The first session for today is on symptom management. We will touch upon the symptoms which patients may experience during the different steps of their kidney experience, including restless legs syndrome, insomnia, itchiness, and dry skin. Our patients will also speak about their experiences, their current their frequent symptoms, their less frequent symptoms, and the way they've been educated, and the way that they deal with these symptoms. They will also be joined by a nephrologist and a pharmacist specialized in nephrology who will provide information on CKD and on solutions and possible strategies. A patient with a kidney disease will discuss their experience, and a number of social workers will discuss the various federal programs who will provide information to you so that you can find what you need and to take advantage of the systems which exist. I would now like to introduce our moderator for this session, Ms. Teresa Atkinson.
Thank you, Philippe. Hello, everyone. I hope you're doing well, and I'm excited to be your host today. So my name is Teresa, and I've survived a diagnosis of kidney disease for 38 years. And I've been living with my third miracle kidney transplant, that I call it, from the highly sensitized list for the past 7.5. Having undergone all forms of treatment that are available to date, I know the variety of symptoms one may experience on a kidney journey. At this time, I'd like to welcome my fellow panelists and give you a little information on their background. Jacqueline is a patient partner who was born with birth defect that required her to go on PD as an infant. Then, after her doctors performed a successful life-saving heart transplant, Jacqueline, it was not a transplant, surgery, she was able to go off until she was 18 when her kidneys failed and she had to go back to PD. She has unsuccessfully attempted to switch to hemodialysis and been told a transplant is unlikely. Vincent is a patient partner who was diagnosed with IgA nephropathy late in his life. He's been on peritoneal dialysis for about 6 years and has since received a kidney transplant. And I'm sorry, I forgot to note when you got that, Vincent, but I'm sure you will share. Dr. Key, who is joining us, is a nephrologist at the Trillium Healthcare Partners in Mississauga, Ontario, and he acts as a clinician lecturer, a subspecialty lead, and a clinical investigator as well. And of course, last but not least is Megan, who is a pharmacist with Halton Healthcare in Ontario, and she has a passion for directing patient care and helping patients, caregivers, and colleagues to navigate the complexities of medications and their symptoms in chronic kidney disease. So if we could start off with your story, Jacqueline, if you would share a little bit more about your history and your symptoms and how you've dealt with them. Over to you. Thank you.
Thank you. My name's Jacqueline. I'm 27. I've had kidney disease my whole life. I started PD at 18 years old. And I'll go over 5 symptoms that I faced throughout the years, and then in the end, some generalized coping skills. So the symptoms will be sleeplessness, fatigue, mood change, joint pain, and restlessness. Sleeplessness affects people in different ways. Some people can have difficulty falling asleep, staying asleep, or just sleeping in general. When we sleep, it's our time to rest, repair, and recharge. So it is very important to sleep. This has affected me more so in my later years, about when I was 15 is when it started. It made focusing challenging and having the motivation to do things like getting up, going to school, and working on schoolwork, hanging out with friends, etc. Fatigue is the next symptom. Fatigue is a bit different from tiredness. Tiredness is when you can sit down, have a rest, feel rejuvenated, and move forward. But when you're fatigued, you lack that restfulness, which again makes things challenging, like daily tasks, work, etc., and focusing. I didn't thankfully need to deal with this until I was about a teenager. Sometimes this can also affect your mood, your energy, your concentration, etc. The next is mood changes. Mood changes isn't specifically a kidney symptom per se. However, I do believe it is important because, as most of you know, when you have an illness, it can affect your mood. I do find that when the toxins build up due to the kidney decline, it can affect your mood in a negative way, which makes you feel lethargic maybe, and makes it difficult again to get things done, which the sleeplessness, the fatigue, all of it kind of goes together hand in hand. I like to kind of tell people it's kind of like feeling sick all the time. So when you're sick, you have, like with a cold, you have aches and pains, difficulty having motivation, getting up, getting going, you're tired, etc. So kidney patients, I'm sure you know, you're going to feel these things. So to kind of compare a healthy person and a kidney patient having this every single day, eventually it could take a toll on your mood. So I would include it as a symptom of kidney disease or illness. Joint pain is a new symptom for me. It's usually caused by high phosphate levels. Phosphorus can be found in dairy products, meat products, and powdered drinks like hot chocolate mix. It's normal to have a higher phosphorus because our filtration isn't working. It can affect your joints. So for me, it's my hands and my feet, which makes cycling, driving, and walking sometimes unenjoyable and a bit painful. And the last symptom is restlessness. Restlessness is also called restless leg syndrome. However, it can affect the whole body or just one part of the body. And it mainly happens towards the end of the night, at least for me. And I would definitely describe it as sore and uncomfortable. One way I try to get people to maybe kind of understand it is if you ever get a stiff neck, you're constantly moving it, trying to get comfortable, even though usually there's no relief. So kind of imagining that throughout your whole body, it's going to affect how you fall asleep and how restful you feel while you're sleeping. You can also refer to as uncontrollable twitching. You kind of feel like you have to get up and move. I find that I have to actually twitch my body, but some people, they just get up and walk or distract themselves. The coping skills, they're not specific to the things that I've mentioned, simply because sometimes you don't have those quick fixes all the time. But what I'm going to list here is hopefully going to help a generalized version of chronic kidney disease, and then that would in itself affect your experience with it and reduce symptoms, hopefully. The first one's balance. So balance is kind of important for humans in general. So your diet, your exercise, but for kidney patients, it's more important. And the reason that is we need things like potassium, sodium, and phosphorus to live. But when you have too much of anything, it can be bad. And for us, because we're not filtering, it usually tends to build up in the bloodstream, leading to some of the symptoms I've said and later symptoms we'll hear of. You could try making a chart for yourself. So you could have low, medium, high potassium, phosphorus, and sodium, just trying to give yourself a little bit of a guideline because everybody's going to be different. As for exercising, it is very important to do so. However, I find that it is good to take breaks rather than force yourself to go until you're tired. Taking a break sooner would be a lot better. So that's the balance for the exercise. The next coping skill would be distractions. Distracting yourself is very important for everyone, but for kidney patients or people with illness, it's very important because when we have an illness and we just sit with it, sometimes it's healthy if we're doing it in a a good way, because then you're processing and you're figuring yourself out. But if you're constantly doing that, then you're limiting yourself. So it's very good to find enjoyable and personalized activities to help you keep busy and not focus so much on your potential limitations. Day by day tasks is good. That way you're not forcing yourself to stick to, I must do this, I must do that, because every day, as I'm sure you know, one day you can do this and the next day you can't. Being focused on in the moment rather than where you were or where you want to be is important, because we never know where we're going to be. And especially if you have an illness, like I said, 1 minute you're going to be able to do this, so you might plan for it, and then the next you're not going to be able to, or you're going to have to make compensations. It is definitely good to not assume that you can't do something. Trying things is good. For myself, I could have dropped out of high school. I'm sure people would have given me the excuse, but because getting up, going to school, you're not sleeping, you're tired. And I didn't know a lot of my symptoms at the time. I just kind of went through life and assumed I was just being a teenager and being lazy. So, you know, walking up the stairs, I get breathless, and I'd have to kind of compensate for that by leaving earlier to get to my next class, or just accept the fact I'm going to be late, explain to my teachers, like I wrote them notes. So it's definitely good to, when that happens, it's good to kind of focus on finding ways to make it work for you, and also working on your schooling, work, or daily tasks, whatever you're doing in your life, rather than focus on what you can't do, because it can definitely get frustrating. And the last thing is, I labeled it ignoring and prioritizing. And I will explain that because I know it sounds bad. All the doctors are like, no, don't ignore. Definitely, you need to understand your kidney failure. You need to understand how it affects you, and balance everything we've talked about. However, going back to high school, because that's when a lot of things happened, it was definitely good for me that I didn't focus on, I can't do this because of my kidney failure, I'm just not going to do it. The fact that I turned around and said, I'm walking slower today, maybe it's because I didn't sleep well, maybe it's because I'm just feeling lazy. When this happened, it made me find ways to get around it rather than throw my hands up in the air and say, well, I have kidney disease, so I just can't. So you can kind of look at it as not letting chronic kidney disease dictate your life. If your team give you suggestions on what you can and can't do, well, they probably wouldn't say what you can't do, but if they give suggestions on maybe things that you should avoid, I think it's good to give it a try, because again, we want to put the patient before the disease, and mainly for yourself. Yeah, definitely trying is better than not trying. Again, I could have walked away from a lot of things, but chose to not. So yeah, that's kind of what I got for the symptoms and the coping skills. The only thing I would add specifically for the restlessness, which is again a new symptom for me, elevating your legs, if you're feeling it in your legs, is good. I'm assuming if it's in your upper body, walking around would help. That hasn't worked for me yet, but if it's in the legs, if you elevate them, I don't know why, but it seems to decrease. And sorry, the other thing is, one way to manage symptoms is obviously through medication, but just make sure it's prescribed from your doctors. Thank you.
Wow, Jacqueline, lots of great tips there from you, as well as analogies to express what you're feeling. That is often such a difficult part for us to explain the symptoms that we're feeling. Over to you, Vincent, to share your story, please.
Merci, Teresa.
Thank you, Teresa. So, just to get back to what you were talking about, my name is Vincent. I am 38. I was diagnosed in 2016 with kidney disease. I started dialysis in 2018, at the end of 2018, and then I had my transplant in November 2020. So it was quite a rapid process. And November 2020 may seem like a long time ago, but it was at the height of the pandemic. And so this was a challenge, and I will speak about it a little bit. And just to explain things, I'm going to talk about my symptoms before my diagnosis and then during dialysis, and then the symptoms which continued, the symptoms that appeared after my transplant, and the way that I was able to live my new reality as a person with a transplant. Before dialysis, in the years prior to my diagnosis, I was affected by the disease, but I wasn't aware of it. I had some problems with depression. I also had frequent migraines. I started to have muscle cramps, and they continued during dialysis. I had pain in my toes and my feet and my forearms. It woke me up at night. I would put a sweater on and then it would feel too tight on my neck. And I also experienced symptoms when I was playing sports, movements that seem simple, using my feet. For example, when I was playing hockey, when you're wearing a skate, you can't really move your toes, and you can imagine that it was very debilitating. And during dialysis, I had problems with constipation, and this was peritoneal dialysis, so it was a vicious circle with dialysis. Things weren't draining well, and the fact that it wasn't draining well meant that there was still liquid in there, and so this exacerbated my constipation. So I tried all the laxatives that are available in order to find the right one to have a sort of an equilibrium. I didn't want to have to take too many laxatives, and also I didn't want to experience side effects from these laxatives. And I wanted my dialysis to work. So there's this particular aspect which was difficult to manage, and the fact is, with laxatives, I had to go to the bathroom quite often at work, at home, and I felt that I was sitting on the toilet a lot. And Jacqueline spoke about insomnia, difficulty sleeping, and I'd just like to touch upon the fact that sleeping with this dialysis liquid is quite uncomfortable. And so this made me more fatigued and made my sleep not be particularly restful. And then I had some nighttime symptoms prior to my diagnosis, and these symptoms continued until today. And I've spoken to my treatment team, and they haven't given me a reason for this, so it's something that still affects my sleep, and it affects my mood, since I don't sleep well. And during dialysis, and this happened just before my diagnosis, nausea, frequent vomiting, with all the toxins that were accumulating in my body. So the body has difficulty managing all these toxins. And so this causes some discomfort. So since my transplant, a lot of symptoms have disappeared. Cramps have basically disappeared. I still have them at times, but only in my toes. So everything to do with my neck, my arms, my legs, all these things have disappeared. I had itchiness, and that's completely gone. Headaches. So since my dialysis, and now that the pressure has been controlled, my headaches have disappeared. I still have them from time to time, and it's probably more related to my medications that can cause them. So it's not constant like it was before, when I had this pressure problem that was basically omnipresent. And there's heartburn, which has appeared with my new medication. And before I said to myself, well, perhaps this is just part of my new life, this is the way it's going to be. But a solution was found with a medication which allows me to control this. And constipation is basically gone, gastric reflux is under control. And my diet is more controlled. I'm trying to find the right word, but I've certain nutrients like phosphorus and potassium. This is no longer something that I need to measure and quantify. So this is an additional freedom, which is quite significant. And there is some shaking that's caused by the use of this medication, especially in my hands. And sometimes this can be inconvenient if we have tasks that require fine motor skills. And I notice it especially when I'm trying to prepare food and I have to cut something. And well, these types of tasks where you need to be very careful. But I console myself by saying, at least I'm not a surgeon. And so I don't really need these fine motor skills on a daily basis. And next, there's body image. I'm someone who's always been fairly skinny. And so I had some difficulty putting on weight and putting on muscle. So, and there was a graft in my abdomen, and I was told that perhaps as a result of this graft, there would be sort of a lump in my body, but I wasn't really expecting it to be the way it is. I was always someone who was fairly lean and in shape, so this sometimes can affect my flexibility. Sometimes when I'm tying my shoes on the street, I have the impression that things are a little bit uncomfortable. So, but I try to just to adjust the way that I see things and put things into perspective. And I'd like to talk about something that I found difficult with respect to my transplant. I had a dialysis period where I was basically fighting for my life. My kidney function was so poor. It was practically nil. And so in order to stay alive, I had to do dialysis, and I put all my energy into this. I kept working. And I had the impression that with the transplant that this would no longer be the case, and that after I got the transplant, I wouldn't have to deal with any of these issues. And so when we're preparing for a transplant, we go over things quickly that we're going to have to deal with afterward. And so just before I left the hospital, when I was explained that I have to be much more careful with the sun in terms of skin cancer, and I have to be concerned with various other cancers, and I needed to protect myself from the sun. I also needed to be careful about about food hygiene, food cleanliness, and I never thought about this before. These kinds of limitations in terms of raw foods, and that I could eat before, but now there are things that are more risky, and of course infections as well. As I mentioned, there was COVID-19, which is now part of our lives, and it was very, very present during my transplant, so it was an additional stress that I had to deal with. And the fact that I was trying to restart exercising during dialysis, I really had very little energy, and so restarting exercise was very difficult. And it was only after 1 year, and I didn't realize it would be so difficult to start exercising again. So this is something that I'm still trying to do, restart my activities. And there was the fact that I stopped working, and this was difficult to manage. and finally I quit my job, and so I'm still off work for medical reasons. And this brings me to speak about mental health. Jacqueline spoke about it. It's hard to remain optimistic. And we shouldn't hesitate to speak about it. And we should speak to our team about these things. I thought that it was something that was automatic, but this wasn't the case, and I didn't really mention it. And so, as I said, I was fighting for my life. So I was very much invested in this, and at a certain point, it simply became too much. And dealing with these new realities after my transplant, the fact that I had to deal with new issues, changes to my taste, for example, this was really the straw that broke the camel's back, and it brought about depression. So don't hesitate to speak about these things, and know that there are going to be challenges after a transplant, but they're not insurmountable, and it's really nothing compared to what we had to deal with beforehand in terms of dialysis, this very difficult period. However, it's very important to get ready for this whole process, and your care team, or there are mental health specialists who can help you with these things. And I think I will just end on a positive note and say that, and I'm trying to talk about the more difficult things, but I wouldn't change my decision to get a transplant. It was really something that was liberating. The doing dialysis every day, feeling connected to it, and I had difficulties during the night, and if I moved from one place to another, it required a significant amount of logistics, and so this freedom of movement is really quite significant, and it's really priceless. My energy came back, and my diet, in spite of restrictions, it's actually much simpler. So, as I mentioned, and perhaps some of you read it in my short biography, I really feel like I have a second lease on life. So there you have it. I hope I didn't discourage you too much in terms of the new issues that I have to deal with, but thank you for letting me speak to you about my experience.
Thank you so much, Vincent, for sharing so honestly and frankly some of the symptoms you have dealt with. And as you say, it's certainly worth the transplant, but there are challenges with it. So now I'd like to share a little bit of my symptoms. I can empathize with both Jacqueline and Vincent because I've been through their symptoms, but I crashed into kidney disease. So I basically woke up in the hospital doing PD and had no idea what my kidneys did. There were no symptoms prior to kidney disease. And certainly, I've experienced the restless legs and the itching and the nausea and things like that come after with dialysis. But one of the big ones for me was they tried to build a fistula 3 times and were unsuccessful for hemodialysis when I attempted to do that. And so I ended up with grafts. And of course, many of you may not know, but grafts are more difficult to needle. And so I would go to dialysis, and it was always such a big trauma for me to actually get those needles in. The nurses were having trouble, and of course, they would feel really guilty. And so when I spoke to my doctor about this, she simply said, and this is back in the 80s when no one was doing it, but Teresa, learn to needle yourself. And I did. It took me forever because I was no way poking a needle in my skin, but I had the nurses poke it into to start. And then I threaded the needle. And eventually I was able to do that. And the pain control by doing it myself was incredible. It was just one of those things that made life easier for me. and I was able to do dialysis for many years with that. Another one of the symptoms that I have really struggled with throughout, and not so much with a transplant, but is that foggy brain feeling that you get. And it's almost, you can't think straight. It's like, I think, Jacqueline, you said, when you're feeling sick and you have a cold and those kind of feelings, like, don't challenge me with a complicated question. And my hubby would actually learn not to question me on day 3 when I hadn't had dialysis. Like, we would just have casual conversations and not talk about the big stuff in life. And so those were some of the coping skills that we dealt with for that one. Certainly. Post-transplant, certainly some of the same ones that Vincent has mentioned, but the tremors for me can cause some real issues. They're noticeable to other people, certainly, and so that can often be a bit of an embarrassment. I mean, sometimes people think you are doing drugs and not on medication, so you do have to explain that this is a side effect of one of your medications if you're feeling uncomfortable or want to do that. GI concerns, not so much for me, the constipation that Vincent was experiencing with PD, but with the transplant medications, I have experienced a lot of the other side of GI complications, and that has happened more so when they changed my medications. And I've learned with third transplant, don't question it, just go ahead, let it settle, and in a month, it usually goes away. So it's more of a, my body has to get used to a new medication. So I've learned to wait, give it some time, whether you're starting PD, whether you're starting hemo. Of course, I didn't necessarily know this in the beginning, but now I do with my years of experience, to just give it a bit of time before you really are freaking out because something is happening. Often it will resolve itself. And of course, the last one, I'm a little cognizant that we're running slightly behind, but prednisone for me has caused a lot of mood changes, perhaps some depression occasionally. Certainly, I take antidepressants to help accommodate that. And that was, it took me years to actually talk to my doctor about these issues, because I thought, I'm strong, I'm fine, I'll just manage. And it really is helpful to have those open and honest conversations, whether they be your nephrologist, the pharmacist, it doesn't matter who you're having them with, but to explain your symptoms, to talk to people about them and not just ignore them or bury them as if they are just something you have to deal with. To actually address them. And if you have to deal with them, then you move forward, like Jacqueline says, and you just do what you need to do to live your life and to be who you want. So those are some of my symptoms that I have experienced throughout my journey. And now I'd like to turn the presentation over to Dr. Key, who's going to share a little bit about why we might feel some of these symptoms as a kidney patient. Thank you, Dr. Key. Over to you.
Thank you, Teresa, and thanks for having me today. It's always a very humbling learning experience for me when I get to sit down and listen to patients talk about kind of their own experience. And it never ceases to amaze me how there are many common symptoms, but everybody has their individual experiences that at least help me to kind of understand even more the impact of kidney disease. So I'd like to kind of talk about kind of from a physician's standpoint, a little bit more about why we get these symptoms. And I want to do, one of my main messages I want to convey is that these symptoms are real. There is definitely a link between having kidney disease and having many symptoms. I always try to put myself in the patient's shoes when I meet with them. And I find if I were a patient and I get diagnosed with a condition, one of the things that really kind of causes a lot of stress for me is maybe not understanding exactly what's happening when you have a certain disease. And kidney disease is by far one of the most complex diseases out there right now. And I'm not just saying that because I'm a nephrologist, but it's true. Not understanding how a disease takes hold of the body and how it's going to manifest itself can cause a lot of stress in and of itself. So for me, I think having an understanding of the disease and how it may affect you is important in coming to feeling a bit more comfortable dealing with symptoms and conditions. So going back to kidney disease, I think the first thing we need to do is kind of understand what happens. So the kidneys are 10 centimeter and sometimes only 1 10 centimeter kidney bean-shaped organs in your mid-back. And their main purpose is to clean your blood. And that includes removing toxins that we generate from a day-to-day basis. It means balancing the different salts in your blood, so your sodiums, your potassiums, your acid and your bases, your calcium, your magnesium, your phosphoruses, and keeping those all in check. At the same time, it also removes a lot of excess water that may be there. And on top of the cleaning functions, your kidney also regulates bone health. And many of you may have heard of the parathyroid hormone and the calcium and phosphoruses. And the kidney plays a very important role in controlling these salts in order to maintain bone health. And finally, one of the big functions of the kidney is to actually tell your bone marrow to make blood. And so some of you are on a medicine called RNS or EPREX, which is an erythropoietin, and that's a hormone that the kidney is responsible for making, and that actually helps you build blood. You think about the heart, you think about those muscles for your heart to pump. In order for any muscles in your body to move, you need a very delicate balance of all the salts, the sodiums and the potassiums specifically. And on top of that, your muscles and all the cells in your body are sitting in a liquid environment that is also very pure when you have full kidney function. And so they need that environment for them to contract and to relax properly. So the same goes with your muscles in your hands, your arms, your legs, all over your body. Your muscles require that delicate balance of salts, and it needs a delicate environment to contract and relax properly. Nerves are very similar to muscles. They need that same balance of salts and environment to send that electrical signal from one point to another, from your brain to whichever organ you want to move. So you can see here, this is a basic list of most organ systems that are affected. So I was talking about the nerves, I talked about the muscles. Your bowels are the same. Your bowels are all muscles as well too. So if you need that environment for those muscles to move properly. So when you have an environment that's not as good, those muscles don't contract properly, and so your bowels don't move properly as well. We talked about the bones. Your immune system, all your immune cells also require a very delicate and clean environment to perform properly. So your platelets stick or they don't stick properly when the environment is not proper. Your immune cells, so your white cells that go fight infections, don't work as well if you don't have the proper environment for them to work. And so there's more risk of infections when you have kidney disease. The skin, we hear about skin itching, probably by far one of the most common symptom complaints. The skin is the largest organ system in your entire body, and it's basically a network of cells. And again, if you have an environment where the cells are in that isn't good, those cells don't work properly. And on top of that, if you have extra waste products, they can deposit in the skin, and that can cause your skin to become irritated, and that can generate that itching sensation that most people have. Now I have a picture of the genital reproductive systems. Well, when you have kidney disease, that impacts a lot of those natural reproductive functions, those hormone functions. So we hear about issues with libido. We hear about issues with erectile dysfunction. We hear about issues with menstrual abnormalities, having difficulty getting pregnant. These are all things that can happen and are all related to that can all be affected by chronic kidney disease. Next slide, please. So you can see a lot of organ systems can be affected. And if you wanted to put it simply, if the cell is this emoji here, every cell is sitting in a liquid environment. And so normally when you have normal kidney function, your cells are kind of like at a beach. They're very happy, they work well. But as the kidneys start to decline, if you go to the next slide, the environment becomes more hostile and looks kind of like this. Well, I can imagine if you were the cell, you're not going to be very happy functioning in this environment compared to the beach. And so things are going to start happening and becoming dysfunctional. And physically, for you, that means experiencing some form of symptom. So next slide. So as a result, as our kidney function falls, it's no surprise that different organ systems start to become problematic, and then patients start experiencing different symptoms. For the most part, these symptoms tend to happen later on in the kidney disease course, usually below kidney function of about 30 mils per minute, or what we describe as stage 4, stage 5. But everybody's different. We can have symptoms even before these thresholds, and it's probably dependent on other medical problems that patients may have as well too. But we're all individuals, and so it's not always going to be the same. But the bottom line is kidney dysfunction definitely leads to symptoms for our patients. Next slide. And here you go. Here's a potential list of all the symptoms, much of which everybody's already noted here. We've heard about the inattention and the confusion. Well, if you're dealing with a lot of symptoms, and if the brain is having to function properly in an environment that is not more ideal, it's no surprise that there's difficulties for the brain to focus. And that may manifest itself as a foggy brain, as Teresa had mentioned, or as Jacqueline, having difficulties even handling more complex decisions and learnings during school. It's not a surprise, because the brain isn't in an ideal environment to perform at 100% efficacy. Sleep can be disturbed. Well, sleep is we're coming to learn nowadays that sleep is a very complex process that involves a host of hormones being released at the right time, and the brain cycling through a very complex cycle. Well, again, if the brain can't do all these things properly because of the environment it's in, well, then sleep can be disturbed as well too. Skin itching, we've talked about that with the toxins and the irritation at the skin level. That skin itching can always be a problem as well. I had mentioned, I had heard about the whole diet issue, and I forgot to note that here. But as our kidney disease progresses, you always hear us and the dietitians talk to you about, you can't eat this, you can't eat this, and you can't eat this. And I am always feeling unhappy with having to do that, because food and is an enjoyment in life, and having to really restrict yourselves, I can only applaud you on how difficult that is. And so having to cope with that too, I'm not surprised people can get stressed as well too. It's very difficult. So and then the appetite changes as you go down, as your kidney function goes down as well, and you're even more limited in what you can eat. So that becomes a big challenge for all. So you can see an organ like the kidney, as it goes down, basically touches every body system possible. And when every body system becomes affected, you get symptoms of every sort possible. And that's where it's a very big challenge for all. And even for us as clinicians, trying to gain control of some of these can be a challenge for us as well too. So next slide. And I don't want to forget, this is probably by far one of the biggest issues that is coming more to the forefront these days is mental health. So not only can we explain this from a physiological basis, but if you think about it just from a practical standpoint, when you have all of these things to tolerate and manage, all these symptoms to tolerate and manage, and then on top of that, you have real life issues that you have to manage as well too, whether it be education, work, family obligations. It's hard to not see someone becoming emotionally and mentally challenged because of it. There's a lot to deal with and a lot to contend with. And so mental health issues are very easy to become an additional symptom to the overall complex. And we do know that it's very common. We're looking at about 60% up to 60% of patients will have some degree of mental health issues, especially those who reach the point of needing dialysis. And again, lots of theories out there as to the cause, but it is real. And this is something that we do require a collaboration to help you with control. Next. So with so many organ systems at play, treatment and management, as you already probably know, can be quite a challenge, but it's not impossible. And I think one of the messages that has come through today that it's very important is that make sure you do bring it up with your team, bring it up with your nurses, bring it up with your doctors, bring it up with your allied care team, because only when we know will we be able to start instituting some sort of plan to help manage your symptoms. Now, given the time constraints, I don't think I can talk too much about this, but maybe during question period, we can address more specific questions about treatments. But I think what Vincent, Jacqueline, and Teresa have brought up in terms of some of the mechanisms to cope and handle some of these symptoms are actually very good advice. So I think I'll skip to the last slide if possible. Or actually, can you go to the restless legs? So with restless legs, I know that's a very, one more. Yeah, here we go. With the restless legs, it's probably one of the most common uncomforting symptoms. And this could be multifactorial, and definitely trying to keep exercise, your sleep as good as possible is important, but there are certain things that we can do. Dialysis is going to be an important part for those who are on dialysis, making sure you're dialyzing well. But iron deficiency is a big cause of muscle irritability. So always making sure that your iron levels are good is an important part of managing this. And of course, there are other medical problems that can also drive restless muscles. So, and if you go to the last slide, I just wanted to conclude, there is the Ontario Renal Network actually puts out pamphlets for patients. And I've left the link here at the bottom. If you access this link, there are actually patient information packages for very common symptoms, and it may give you some mechanisms for managing these particular symptoms as well. So with that, I do thank you for the opportunity for speaking today, and I'm sorry for going over time a little bit. So thank you.
Amazing. I even learned some things there. I had no idea the kidneys controlled all of those functions. Thank you for sharing all of that knowledge, Dr. Key. And now over to Megan, who's going to talk to us a little bit about pharmacists and the medications.
So my name's Megan. I'm a renal pharmacist from Halton Healthcare, and I'm going to continue speaking about dealing with symptoms, and more specifically, how your renal pharmacist can help you. Okay, so I'll just start without the slides. So over the next few minutes, I'm going to very briefly touch on, as Dr. Key has already done, why you may be having symptoms, what those symptoms may be, how you and your care team can work together to manage those symptoms. And lastly, mention some ways that your care team go about treating those symptoms. So we've all been talking about dealing with symptoms, and Dr. Key has gone over many of the ways that those symptoms pathways. So because your kidneys clean your blood, you can, as has been said, have a buildup of toxins and byproducts, and that can lead to issues such as the nausea and vomiting, loss of appetite, the foggy brain. Okay, great. If you could go one more slide, please. Good, thank you. And because your kidneys remove fluid, you can have a buildup of fluid, especially in your ankles and feet, as well as shortness of breath. Your kidneys are also responsible for balancing chemicals. So an imbalance of chemicals and electrolytes can lead to the restless legs that we've all been talking about, itchy skin and muscle cramping. Your kidneys are also responsible for releasing certain hormones, such as erythropoietin, which stimulates the production of red blood cells, and also an activated form of vitamin D. So with lowered levels of these hormones, you could experience fatigue, shortness of breath, feeling cold all the time, as well as itchiness and bone pain. And I also want to mention that, of course, the medications you take, a lot of what you're taking are for your kidneys, can also have side effects. And although the symptoms from kidney disease may differ from your side effects, they can all add together to really impact your life. Okay, next slide. So we've all been talking about symptoms, and everyone has discussed a variety of symptoms. Here's a list, although definitely not all inclusive. A lot more symptoms have been listed here. And also side effects from medications can be broken down into broad categories. And I've listed some examples of these here. Central nervous system side effects could include difficulty concentrating, sleep disturbances or mood swings. Gastrointestinal side effects, of course, anything to do with the tummy, so nausea, vomiting, abdominal cramping. Musculoskeletal side effects could include tremors or muscle pain and weakness. Dermatological side effects could include hair loss or itchy skin. Myelosuppression can lead to an increased risk of infection or bleeding, or symptoms of anemia like the fatigue, shortness of breath, and feeling cold. And as has already been mentioned once in this talk, I wanted to point out prednisone as an example of a medication that can really impact someone's life. So this is a steroid medication, which some of you may be taking, depending on the cause of your kidney disease and whether you've had a transplant. And it has a long list of side effects, and 3 of the most distressing that I see seem to be difficulty sleeping, mood changes, and weight gain. So as you can see, there's a big overlap between symptoms from kidney disease and side effects from medication. And it's really important for you and your team to work together to try to figure out what is the cause of what you're feeling. Next slide, please. So what do you do if you're experiencing any symptom or side effect? So first off, please remember that these symptoms are normal and real. So if you're having issues with people in your life not believing you, please lean into your care team so we can provide you with the tools and the knowledge to both validate your symptoms and educate those around you. It's also important of course, important to tell your kidney care team about your symptoms. And most care teams do include a renal pharmacist who has experience in dealing with these types of symptoms and also has experience in managing the complexities of medication use in kidney disease. Please give lots of details of your symptoms. So, for example, say you're experiencing itchiness to the point where you're not sleeping at night, your mood is depressed, and you feel like you can no longer manage. But then you go to your appointment and the care team is only talking about your potassium. So this can lead to, number one, you feeling so unheard and disheartened that you're not able to put into place the plan for your potassium, which can be dangerous. And number two, a proper plan might not be implemented to deal with your itchiness, perhaps because you didn't mention it, or maybe just didn't really explain the very profound effect it was having on your life. Please also keep records, for example, when your symptoms started or when it gets better or worse. It's also important to tell your care team about any side effects to medications that you may be experiencing and ask lots of questions. For example, is there another medication I can take instead of this one that doesn't have this side effect? Or is there a way to manage this side effect? For example, when Vincent started a medication to help with his heartburn with certain of his medications. And then what will your pharmacist or care team do when you present with a symptom or side effect? So we'll have to gather lots of information. We'll have to figure out what the cause is. So we might look at your vitals, your blood work, medication changes. And as was said before, we'll really need to understand how this symptom is impacting you. This may help us to prioritize issues if we're dealing with a lot of different issues at once for you. And it could also change the initial treatment plan depending on whether the symptom is bothersome to you versus intrusive. And of course, we'll need to see what treatments have been started so far and what makes it better or worse. It's also important to talk to your team, especially your pharmacist, about medication overload. So this is when you're feeling overwhelmed and down because of all the medications you have to take. So these are valid concerns, and if they're not addressed, it could lead to you stopping some or all of your medications, which could have very dangerous consequences. So please remember that medication regimens can be simplified usually, and your renal pharmacist is a great resource to help with this. Next slide. Okay, and lastly, let me talk a little bit about treating these symptoms. So the purpose of this talk was not to discuss any specific symptoms in detail, but rather discuss symptoms as a whole and how your care team can support you. So sometimes we may implement non-medication treatments. So some examples of this are discussing good sleep hygiene for someone dealing with insomnia, or perhaps ways to keep your skin moisturized and prevent it from getting inflamed if you're dealing with itchiness. Other times we need to start over-the-counter or non-prescription medications. But please remember that just because you can treat yourself with an over-the-counter medication, it's very important to include your care team in this process. So just because you can pick up a medication off the shelf at the pharmacy doesn't mean it's safe for you. For example, it could be damaging to someone with kidney disease or could interact with some of your other medications. It's also important to remember that herbal medications can have a long list of side effects and drug interactions as well. So please do tell your team if you're taking any herbal meds or if you would like to start any. And other times we have to rely on prescription medications. So for any new medication started, it's important to have all the information necessary to lead to best results. So for example, it's important for you to know what are the most common side effects of this medication and what do you do if those side effects occur? For example, who would you contact or how could you manage it on your own? It's also important to know how long this medication will take to start working. For example, antidepressant medications can usually take over a month to start improving your mood. It's really important to have that type of information so that you don't prematurely stop a medication thinking it's not working. You also should know if there's any particular way a medication should be taken. For example, separating your iron pills away from your food so that food doesn't block the absorption of iron, or taking water pills in the first half of the day so that you're not up at night going to the bathroom. And then I think there's one more slide. Okay, so I just wanted to say that I hope everyone listening remembers that you're not alone. There's an entire community of people going through similar issues. And I want to thank the Kidney Foundation for events such as this that bring people together to share their experiences. And please remember your care team is there for you. So please do use us. And by working together, we can get you on the right path to dealing with your symptoms. So thanks for listening.
Thanks so much, Megan. Great tips and advice there. And thank you everyone for all your valuable information and insight. I think we've learned a lot, but I want to get to some of the questions that we have here coming up in the chat. So regarding supplements, you spoke a little bit, Megan, but specifically they're asking about turmeric and curcumin. I think I'm saying that right, supplements. Are those generally recommended for kidney patients, or is that something they should talk about one-off with a professional? And I'll hand it over to Dr. Key first, and then Megan.
Yeah, so unfortunately, with a lot of these supplements and minerals and herbs that are out there that are available, there's really no guiding data behind safety and efficacy for use. Now, I kind of take a little bit of a practical approach. So if it's something we can eat that hasn't been found to be excessive in potassium, for instance, then I'm usually okay with them having a little bit. The other problem with some of these supplements is not everyone is the same. So you have different brands of the same thing and you have no idea what else they put into them. So there's a lot of, from my standpoint, I don't tend to recommend specifically any particular herbs. And from a kidney perspective, there's no studies to show that they really do anything for kidney patients.
Thank you. Megan, did you have anything to add?
Yep, I just wanted to add that, so I echo what Dr. Key has said, and just wanted to mention that specifically with that herbal medication, turmeric, there are drug interactions with that medication, especially if you're taking any blood thinners or diabetes medications. So please do talk to your team if you are taking that or you would like to start. So like Dr. Key said, oftentimes if it's in small amounts and it's something you can get in your diet, it's probably fine, but it depends how much is in it. And as Dr. Key said, it may not be standard. It's not standardized, so you don't really know exactly what you're getting.
Thank you. Great advice from both of you. Obviously, need to check things out and be careful when it's kidneys. Another question that's coming in, perhaps Jacqueline and Vincent, how do you explain your symptoms to your family and friends? Like, Jacqueline, you gave some great examples. Do you use those when you're talking with your friends about your symptoms, or do you not share so much?
Sometimes I do. Depends on the day and the person, what works for them. But actually going back to what Dr. Vincent said, excuse me, sorry, I'm getting over COVID. When I was in high school and actually throughout my whole life, maybe not the biggest challenge, but one of the bigger challenges was everything that I faced. Everybody kind of said, well, I faced that too. And that's kind of the hard part of kidney disease, is that it all looks the same. People have itchy, people have dry skin, people have sleepless nights and stuff like that. So when I would talk about my symptoms, they would say, oh, I get that too, grow up. And it actually, one time I passed out in front of my friend because my blood pressure was always high, and then my period, I guess, dropped it really low, blacked right out. And then it was at that point they were like, oh, maybe you feel things a little differently than us. But even when I did try to explain to them, my biggest issue was nothing I really kind of explain actually translated to the intensity of kidney symptoms.
Really good point. How about you, Vincent? Any tips or tricks on how do you talk to your friends and
Um,
family?
I think it's I can relate to what Jacqueline said. A lot of people didn't understand, had trouble understanding the extent of the symptoms. So I would talk about it only with people that would ask, or I mean, very specific people, like that I would have uh, confidence in, like a good relationship with, and I knew that they would understand and not downplay what I was living. And yeah, I forgot. Still got some foggy brain sometimes, but yeah, like really pick your people, and even with family, sometimes it was hard because you don't want to be the Debbie Downer, in the party, or so. Yeah, mostly with the care team. And one thing I'm doing right now is support groups for depression and stuff like that. And I found it easier with those people because it was the place to talk about stuff like that. So the reception
Yeah,
was better. I could explain more like the way I felt about it.
that's
So
a
yeah, that's
great idea.
my point of view.
Um, yeah, I really like that one, Vincent. There are certainly support groups and peer engagement opportunities here at the forum as well as at the Kidney Foundation and outside as you're talking about with depression, Vincent. So really great tips of where we talk to people and how we talk to people. So I have one question here about why do transplant patients who are supposed to be healthy afterwards still get so many symptoms? And Megan, I think you touched on that a bit with the medications, but could you talk a little bit more about that? And perhaps Dr. Key can chime in after.
Well, transplant medications, as we heard from Vincent, they do have a lot of side effects. So a lot of the symptoms do change, as Vincent explained. You don't have to deal with a lot of issues, but probably from what I see in my practice, the biggest issue is the medications. And you have to take a lot right in the beginning, and then some get slowly tapered off. And it's really important to work with your team to figure out, make sure that you're on the right medications for you. Make sure that we're managing the side effects as well as we can. Sometimes it takes some tinkering with the doses of the medications. Sometimes we can adjust them a little bit, but usually we can help people. So just make sure that you tell your team anything that you're feeling.
Thank you. Dr. Key, did you have anything to add?
Yeah, so that's definitely a big part of the medications, but remember your post-transplant. So the first year is usually the year where you probably are a lot more symptomatic. Part of that is being post-operative, so having had a surgery. So you're recovering from the surgery. The other important thing to remember is a lot of people who get a transplant, they've had a number of years of disease. So their body has become almost accustomed to an environment that most kidney failure patients have. And so after a transplant, it's almost like I don't know the best explanation. It's almost like a sudden reset. You have a new kidney that's cleaning the environment very well, but your cells are having to now readjust to this brand new environment because they've already acclimatized to the original environment, and now your kidney's cleaning it. That's a big change for the cells. So you still may have symptoms after a transplant, but usually after about a year or so, a lot of things start to kind of calm down, and things are more stable by then. So, and I think it's probably the body also readjusting to a new environment.
Thank you. So we have time. We're almost out of time here. I want to just get this one last question in, and I'm sorry if we've missed any of your questions. So this is to the panelists or the patient partners, sorry. who did you go to generally and found was most able to understand your symptoms in your care team? Was it the nurse, the doctor, your family doctor? Who did you really use to share your symptoms best? Vincent, would you like to go first?
Yeah, sure. Is it for Marie-Christine?
Pardon me?
Marie-Christine, is it the Marie-Christine question?
Yes, yes.
Ok, je vais répondre en français. Donc, ben,
Okay, I'll answer in French.
ce qui m'a le plus manqué,
What I was really lacking, well, I had a time where I felt that there really wasn't collaboration, but generally speaking, there was good collaboration
c'est très important.
with the patient. This is a very important thing.
Ils ont toujours fait des efforts
They always tried
disons,
to
problèmes ou mes
deal with my specific problems and questions, to answer my questions.
disponibles sur appel. Là, il y avait
They were available, they were on call.
pour
There was always someone who was on call and who could call me back very quickly.
j'ai parlé avec je voyais plusieurs néphrologues là,
I saw a number of nephrologists in the dialysis clinic,
avec qui j'étais plus à l'aise. Donc, il y
and I
avait
was quite comfortable with some of them, so I would discuss my symptoms with them.
la nutritionniste aussi.
There was a nutritionist as well.
C'est juste d'inclure le patient. Je pense que
So, including the patient, I think,
le principal, c'est d'inclure
is my main point. Including the patient in the process is very important.
Thank you very much. Jacqueline, did you have any additions you'd like to add there?
Nothing in great detail. Becoming an adult, because I had to go through this my whole life. When I was younger, it was mainly my dad would go to every appointment, and we just kind of talked about the blood work and the stuff that's going all the pieces to the bridge, as my dad liked to say, because thankfully I wasn't, as far as I know, too symptomatic. And looking back, obviously I had more symptoms than I knew of. But as an adult, they opened up better communication between patient and nurses, and I'm actually allowed to email my nurse. So I mainly go through her, and then she'll update. If she doesn't have any answers, then she'll update my nephrologist, which I think is really great. Sometimes I'll just kind of give her a little summary, maybe once a month, or unless I'm having a lot of symptoms. That way, instead of her taking extra time to go through the list of patients to check in, an email pops up, she answers it, we deal with it, it's done and out of the way. So I do really like that.
That's awesome. Well, I'd like to thank everyone for joining us today, and to our speakers for sharing their experiences and expertise. I hope you have a better understanding of dealing with your symptoms, as well as some of the common symptoms that kidney patients experience.